Hello my dear students, I'm Dr. Vaishali Bharembe. I've been teaching anatomy for more than 25 years and I love it. Today I begin my series on hip bone. Therefore the lecture's title is Hip Bone Part 1. So remember, throughout these lecture series, I'm going to ask you a lot of questions in the lectures. And often I explain the answers as well. Sometimes I may leave the question expecting you to find the answer. Remember, the idea is to know the answers. You may find the answers in notes section also. Okay? Remember, you have to know the answers. You have to find out the answer. Don't move forward without knowledge. One more request, sit for my osteology lectures with a bone in your hand. See? So I'm sitting with a hip bone in my hand. Why? Because as I teach you, I'm going to ask you to palpate the bone. And you cannot imagine a palpation. Palpation has to be done. So sit with the bone in your hand. Okay, and if you not only sit with the hip bone in your hand, sit with a femur of the same side so that you can articulate them. Okay, hopefully you also have a sacrum with you, sit with the sacrum also. Alright, come, enough instructions, let's begin the study. This is how I'm going to go about teaching the hip bone. I won't read it, you can pause the video and go through it. Let's ask ourselves a very simple basic question. What and where is the hip bone? What are its functions? Hip bone, also called as the innominate bone, is present here. Take a look. Okay? It gives support to your body. Okay? It gives protection to your precious pelvic organs. It's a part of your movement. Okay? Try and move your body without moving your pelvis. I challenge you. Try that. Okay? So it's a very much a part of your body movement. It acts as a source bone for attachment of abdominal muscles as well as muscles of the lower limb as well as muscles of the perineum. Yes, amazing, isn't it? And it's an important part of the body for weight transmission. Your entire body weight transmits through your hip bone into the femur. It's an important, of course, important for childbirth. It's a canal through which the baby is born. And it's a part of, a bone that produces hematopoiesis. It produces your RBCs in the childhood. Okay? So, all this and more are functions of hip bone. Let's find out what are the joints formed by hip bone. Take a look. Hip bone forms joint with the other side hip bone called the pubic symphysis. Forms a joint with the femur, the hip joint of course. And forms a joint with the sacrum called the sacroiliac joint. These are all basics. I'm sure you know all this. But I have to take you through this so that you kind of mentally come into the lecture. Right. So now here is the bone. Alright. We look at it on the screen and then we will look at it on the bone as well. Okay. It's quite an irregular bone. So it's classified as an irregular bone. It's wide above. Observe the diagram I've put up. It's wide above. It's wide below and quite narrow in between. Look at the bone you have in your hand. Is it similar? Yes? Right. So, it has got three basic parts to it. Take a look. Ilium, ischium and the pubis. It also has got a deep acetabular cavity and a foramen called obturator foramen. These are basic parts of your hip bone. Right. So now question is, can I teach you hip bone? Do you know how to hold the hip bone in its normal anatomical position? Do you know how to identify the side of hip bone? Essentially, if you're just starting out with the bone, then you don't know all this. So what I'm going to do is, I'm going to give you bare basics of the bone initially, just so that you hold it correctly. Later on, we will learn the details. Come on, let's focus on this hip bone now. And let's learn a few details of the hip bone to understand normal anatomical position and side identification. Come. So this is your hip bone. Okay. I'm going to rotate it because I don't know anything, you don't know anything. Correct? Okay. Now I can see that it is wide at one end, wide at other end and quite narrow in between. So it's either to be held like this or to be held like this. Correct? Okay. Now, understand that it has a wide crest superiorly. This is called the iliaccrest superiorly. Okay. This is called as the ischial tuberosity, comes inferiorly. So superior inferior is down. Okay. you can see that it shows a little spine here. This is called anterior superior iliac spine, goes anteriorly. Okay. You can see one more spine here. Can you see that? This one. This is ischial spine, comes posteriorly. One spine anteriorly, one spine posteriorly. Iliaccrest superiorly. Ischial tuberosity inferiorly. This is your symphysis pubis surface. Okay. So this symphysial surface should come medially and the acetabulum should come laterally. Let's do this once more. Iliaccrest superiorly. Ischial tuberosity inferiorly. Anterior superior spine anteriorly. Ischial spine posteriorly. Symphysial surface medially. Acetabulum laterally. Broadly speaking, you seem to have the bone in some kind of position now. Okay. Now, remember the acetabulum will point to the side to which the bone belongs. In this case, my acetabulum here is pointing to the right. Therefore, this has to be the right side bone. Okay. So, we've got our side correctly. How to hold it correctly now? See, take your thumb, pass it through this deep notch. Can you see a notch here? Pass it through the notch. Cover the acetabulum with your fingers. Okay. And use this finger to come right below the anterior superior iliac spine. Okay. And now, tilt the bone forwards. Let the anterior superior iliac spine point directly forwards. This is the normal anatomical position of the bone. It's not like this. It's not sitting on the ramus. It's tilted forwards. It's tilted forwards. Tilt it forwards. Now, how much to tilt? Do I have to tilt it this much? Do I have to tilt it so much? I'll tell you, there are three planes which will help you. Symphysial surface should be in the median plane. Symphysial surface should be in the median plane. The pubic tubercle, you can find the pubic tubercle here, and the ischial spine should be in the same horizontal plane. Can you see that? The moment you put them in a horizontal plane, your whole hip bone tilts forwards. Okay. So this is horizontal, this is median. Now remember, your pubic tubercle and your anterior superior iliac spine should be in the same coronal plane. You can take a book and hold it there. Okay. That will tell you how these 2 points should be in the same coronal plane. All this is for the first timer quite challenging, but it's only a first timer. Next time it's going to be something you're familiar with, right? So now you hold your bone in its normal anatomical position. Tilted forwards, symphysial surface in the median plane, pubic tubercle ischial spine in the same horizontal plane, pubic tubercle and anterior superior iliac spine in the same coronal plane. That is the normal anatomical position of hip bone. Now, you will not move the bone. While I am teaching you, hold the bone exactly like this. Don't try to hold it in the left hand to look at something. You will never go back to normal anatomical position. I know, I've taught for so many years. The moment you move the bone, you will end up getting disoriented. Hold it exactly like this. Bend your body to understand. Okay? Is that a promise? Yes? Come. Let's come back to the screen and study this bone. Right. So you're holding that bone in your hand. Let's revise once. This is the iliaccrest that goes superiorly. This is the ischial tuberosity that goes inferiorly. This is anterior superior iliac spine pointing forwards. I often tell my students, point at your examiner with your anterior superior iliac spine and you won't go wrong. Okay. I don't want you to repeat this in your class, but imagine that this is a gun. Okay, and point the anterior superior iliac spine forwards. It's quite a comfortable position and your bone will automatically come to its normal anatomical position. We're going to call it a toy gun, okay, because I don't like guns at all. It's one of the most destructive machines made by mankind, but it's a toy gun, okay. Do you hold it like this? Alright, continue. This is your anterior superior iliac spine pointing forwards. This is your ischial spine pointing posteriorly. Symphysial surface is medially, acetabulum is laterally. If you've got all this, then like I told you, get your bone in the three planes. This is just for you to read later. 1, 2 and 3, these are the three planes you want to keep your bone in. And then the acetabulum will point to the side to which the bone belongs. Remember, you will hold the bone in the side to which the bone belongs. If this is the right side hip bone, I'm going to hold it in my right hand. But I have one more bone. Okay, so symphyseal surface medially, anterior superior iliac spine anteriorly, ischial spine posteriorly, iliac crest superiorly, ischial tuberosity inferiorly, acetabulum laterally. This has to be the bone of the left side. So can I hold it in my right hand like this? Absolutely not. I will hold it again, my thumb through the greatersciaticnotch, my fingers covering the acetabulum. My index finger just below your anterior superior iliac spine. I will hold this bone in my left hand throughout my study session. I will not move it into my right hand. Clear? Come. So please hold the bone in its normal anatomical position. Do not move the position of the hip bone too much while studying it. Right. Point made. So what are the parts of hip bone? Let's quickly revise once. Hip bone consists of ilium superiorly, ischium posterior inferiorly, pubis here anteriorly. There's an acetabulum and an obturator foramen. We got that. Today we'll focus on learning about the ilium. Okay. So this part is your ilium. Take a look. This part is your ilium. Palpate it on your own body. Okay. Feel the iliac crest. Okay. Feel the anterior superior iliac spine. You may not be able to feel the posterior superior iliac spine, but these two, the iliac crest and the anterior superior iliac spine, are very much palpable in your body. In fact, so many of you tie your jeans below your anterior superior iliac spine, and poor teachers like me are worrying about whether the pant is going to stay on or not. Just a joke. But yes, it is a worry for a lot of parents. Okay, so try and tie your jeans tight. Whether it's above anterior superior iliac spine or below, I'll leave it to you. But remember, identify your anterior superior iliac spine, identify your iliac crest. So we will now focus upon ilium. It has an upper end and a lower end. It has got three borders: anterior border, posterior border, medial border. It has got three surfaces: iliac fossa, sacropelvic, gluteal. No point in my showing you all this. I have to show you on the bone. Then only you will understand. Again, you have to learn on the bone. You cannot just read theory like that. It makes no sense. So let's talk about the upper end first. Okay, this beautiful iliac crest is what we're going to focus on now. Okay, that's the upper end. A little bit of theory and then we will come back to bone. That's the lower end. You can see how the lower end enters into the acetabulum. So now I'm looking at the upper end from the top. Okay, so I'm going to look at the upper end like this. This is the anterior superior iliac spine. This is the posterior superior iliac spine. So this is anterior, this is posterior. The iliac crest extends from anterior superior iliac spine to posterior superior iliac spine. It has a ventral segment which is anterior 2/3 and a dorsal segment which is posterior 1/3. Clear? Just in the ventral segment, 5 cm from the anterior superior iliac spine, you will find a tubercle of iliac crest. Okay. The rest of the ventral segment has an outer lip, an inner lip, and an intermediate area. Outer lip, inner lip, intermediate area in between. The dorsal segment has an outer rough area and an inner rough area. These are parts of iliac crest. Let's keep this on the screen and pick up the bone. Okay. I'm going to hold it like this because I want you to see this from here. So this is anterior superior iliac spine. This is iliac crest. This is posterior superior iliac spine. Clear? You can divide this into ventral 2/3 and dorsal 1/3. Correct? 5 cm from the anterior superior iliac spine, here you can see a tubercle. That's the iliac tubercle. The ventral 2/3 has an outer rough edge called the outer limb and inner rough edge called the inner limb. And in between the two, the area here is called as the intermediate lip. Outer lip, inner lip, intermediate area. The dorsal segment, if you look carefully and run your hand on it, it has got a sharp edge above and it has got an outer rough area and an inner rough area. Palpate all this. Okay? Be confident that you know these parts of iliac crest. Okay? come back to the screen now. So now let's see the attachments on iliac crest, okay? So on the outer edge, you have attachment of the fascia of the thigh called the fascia lata. On the medial side, fascia of the abdominal cavity, fascia transversalis. Fascia lata, fascia transversalis. Here, between the tubercle and the anterior superior iliac spine, tiny attachment of tensor fascia lata muscle. Okay. Now we've got outer lip, inner lip, intermediate area. Outer lip in the anterior 2/3 gives attachment to external oblique. Posterior 1/3 gives attachment to latissimus dorsi. Inner lip in the anterior 2/3 gives attachment to transversus abdominis. In the posterior 1/3 to quadratus lumborum. And intermediate area completely gives attachment to internal oblique. Some of you who are probably doing some kind of gymming will be aware of some of these muscles, the obliques, the lats and so on. These are the same muscles of the abdomen which are attached to the upper edge of your hip bone. The dorsal segment on the outer side gives attachment to gluteus maximus and on the inner side to the erector spinae muscle, which is an important muscle of your back. Right. So let's revise this quickly. Divide your iliac crest into ventral segment and dorsal segment. Ventral segment, outer side fascia lata, inner side fascia transversalis. Anterior part, tensor fascia lata. Now you've got outer lip, inner lip, intermediate area. Divide this further into anterior 2/3, posterior 1/3. Outer lip, anterior 2/3 external oblique, posterior 1/3 latissimus dorsi. Inner lip, anterior 2/3 transversus abdominis, posterior 1/3 quadratus lumborum. And the entire intermediate area gives attachment to internal oblique. Coming to the dorsal segment, outer side gluteus maximus, inner side erector spinae. Once you've done this a couple of times, you find you keep hoping that the examiner asks you this because finally it's so easy. Okay, so I hope you find it as easy as I find it. Moving on, name the attachments of iliac crest. Viva question. What is supracristal plane? Find out. What does it correspond to? Please find out the answer. Right. So we come to the lower end of ilium. Okay, the lower end, as you can see, forms a part of the acetabulum. See, this upper end, now as you go down, you can see that it enters into the acetabulum and the upper part of the acetabulum forms the lower end of ilium. I'll tell you why this happens. Come. So what happens is that when the bone is developing, it develops in 3 different bits. Ilium, ischium, pubis. Okay, and all the bits are meeting here in the acetabulum with the help of a cartilage. You can see that I've drawn the cartilage in blue for you to understand. So what happens at around the age of 12, these bones meet and they form this single hip bone that you are seeing. Till then, you had 3 separate small bits. Do you ever wonder when a child is trying to, somehow stand up and the child keeps falling down? So many times, you see a child at around age of 1 trying to somehow stand up and with that little victorious smile on his face. And when he or her suddenly sits down on their butt. And you keep thinking, oh God, that must have hurt so much, but it doesn't. Because the bone is in bits, right? So when the bone is in bits, the bits just adjust, there's no fracture happening. Whereas try falling down like that after you are in a 17, 18-year-old. Okay, there's going to be pain in your butt then. Yes, that's because the bones are fused. The body and the nature has made the whole human body so logical. Nature is aware that the child is going to try and stand up. The bones are in bits, lesser chances of fracture. Once the child is grown up, the nature fuses the bone for strength. There's no requirement for the bone to move against each other. See, nature is the biggest power and it's the most logical power. You may think whatever you want, but human body is one of the most, it's a supreme machine. Not only human body for that matter, any animal body. They're all made at their logical best. If they're not logically right, they don't survive evolution. It's when you are at the peak performance that you survive the evolutionary challenges. That's what has happened to the hip bone. By now you will realize that evolution is rather pet topic of mine. But yes, I find it beautiful. I hope you do too. Come. So these three bones fuse together. Upper 2/5 comes from ilium, posterior 2/5 comes from ischium, anterior 1/5 comes from pubis. Together they unite to form the acetabulum. So that's the lower end of your ilium. That's the line where they fuse. So we come to the borders, okay? So here, go to your anterior superior iliac spine. You find that there's a notch below it. Found it? Another forward projection anterior inferior iliac spine. And then here is the acetabulum and the iliopubic eminence, okay? So run your finger along this border. I'm going to show this to you now. As usual, I hold the bone. So I'm holding the bone in its normal anatomical position, okay? This is anterior superior iliac spine, there's a notch below it. Anterior inferior iliac spine, there's a notch below it, correct? So this is the anterior border of ilium. You don't have to know it. Just remember anterior superior iliac spine notch, anterior inferior iliac spine. These are three projections or depressions I want you to remember. Once you've got your this border, then what is attached to it? Anterior superior iliac spine gives attachment to one muscle, one ligament. Which muscle? Sartorius. Which ligament? Lateral end of inguinal ligament. One muscle, one ligament. Say it once. One muscle, one ligament. Which muscle? Sartorius. Which ligament? Lateral end of inguinal ligament. Now let's come to this little depression here, below the anterior superior iliac spine. Okay. Let's come to this little depression here below the anterior superior iliac spine. It is through this depression that your lateral femoral cutaneous nerve passes. Okay, so remember related here is the lateral femoral cutaneous nerve. Let's come to the anterior inferior iliac spine. Anterior inferior iliac spine, again one muscle, one ligament. Which muscle? Straight head of rectus femoris. Which ligament? Iliofemoral ligament. Which muscle? Straight head of rectus femoris. Which ligament? Iliofemoral ligament. Another name for iliofemoral ligament? Yes, Bigelow's ligament. Peculiarity, strongest ligament of the body. Isn't it fun? As we learn the bone, we learn so much more. Come, let's revise this once on the screen. So now, let's learn the attachments. This is the anterior border. Here is the attachment of one muscle, one ligament to the anterior superior iliac spine. Which ligament? Inguinal ligament. Which muscle? Sartorius. Here you will find the relation of the lateral femoral cutaneous nerve. Okay. Below that again anterior inferior iliac spine, one muscle, one ligament. Muscle is straight head of rectus femoris. Ligament is iliofemoral ligament. Right. So where is the reflected head? If this is the straight head of rectus femoris, where is the attachment of reflected head? Yes, here, above the acetabulum. There. Reflected head of rectus femoris takes origin from the surface just above the acetabulum. Clear? Question again. What is meralgia paresthetica? I want you to find out. It's very, very easy. If you cannot, of course, put it in the comment section, I'll give you the answer. It's very easy. Right. So we've done the anterior border. Let's briefly touch upon the posterior border. Posterior superior iliac spine. Go to the posterior part of your iliac crest. We've done the posterior end of iliac crest. Posterior superior iliac spine. Posterior inferior iliac spine. And then the upper part of greatersciaticnotch. That notch in which you put your thumb. And then there is the ischial spine. This becomes your posterior border. Okay, I'm going to show you this now. Come. So this is the bone you were holding in its normal anatomical position. Now I'm going to turn it around. Posterior superior iliac spine. Depression. Posterior inferior iliac spine. Go deep inside into a beautiful notch, the greatersciaticnotch, ending in this ischial spine. This is the posterior border of ilium. Am I going to teach it? No. We will be learning this and much more in our next lecture. One last time, let's revise. Posterior superior iliac spine notch, posterior inferior iliac spine greatersciaticnotch, and here is your ischial spine. Got this? Come to the screen now. So this is your posterior border of hip bone, which if it continues down, continues into the ischial spine and the iliumbone itself. Thus you can see that the posterior part of the hip bone shows presence of two notches, a greater sciatic notch and a lesser sciatic notch. So with this formation of greater sciatic notch and lesser sciatic notch, on a very interesting note, according to me, we are stopping our discussion on hip bone part 1. Okay, I've asked you a series of questions. As usual, I'm telling you, the answers, a lot of MCQs and notes are available in the notes section. They're also available on my website in case you want to access that. So this is what we learned today. I'm not going to read it, but in case you want to revise, you can just run through this. Alright, and I'll see you in my next lecture, Hip Bone Part 2. If you like the lecture, do like and subscribe to my channel. Share the lecture with your friends. I'll see you in my next lecture. Thank you.